Joining us now is the Science Minister, George Freeman. Mr Freeman, good to talk to you this morning. Thank you for joining us. Well, you were promised a plan by your colleagues, a rollout plan, earlier on this week. Where's the plan?
Morning, Kay. Yeah, good to join you. Today we've got all of the global biopharma leaders here in London to announce another £500 million package into UK life science. And as your report highlights, this pandemic isn't over, and the UK is leading in both the science of defeating this virus and in the rollout package for vaccines here in the UK. We've procured another 114 million doses, so we've got the doses here for patients over the next few months. And we're in a global race to make sure we defeat this pandemic. And I'm here today to talk about how UK science is right on the front line of that. We're working across government to lead the global fight to defeat the virus.
And in answer to my question?
Yeah, so we're working right now across government on how we both accelerate the rollout internationally of vaccines. The truth is, we're not safe until the world is safe, and the UK has led that charge. We've invested more per capita than any other nation. We're huge supporters of COVAX, and at the G7 summit this summer, we led the charge on how globally we support international rollout. Here in the UK, our vaccine rollout programme is setting the benchmark, and that's why we're able this year to not impose the very tough, quite draconian regulations we had to last year in a way that other countries are. So this is UK science leadership and NHS leadership, and the vaccine rollout programme leading here in the UK in terms of science, but also allowing our citizens to enjoy fewer restrictions than in other countries.
On Monday, we were promised a plan. It's Thursday. We haven't got a plan. People don't know when they can have their boosters. Where's the plan?
The NHS have a plan. It's being rolled out and people can apply now. I've just had my text last night. My booster appointment has been offered for next week, and people across my constituency and around the country are able now to get their boosters. And I would, having had COVID myself 3 weeks ago, this is not a nice disease. I was double jabbed, went down for a week, and I would encourage everybody, contact your GP, get on the app, book your booster jab. The NHS is there, we're rolling it out, we've procured the vaccines, and we're leading the world in that rollout. So this is good news. I just encourage everyone. We all need to make sure we get those jabs.
In your 20s and 30s, when can you go onto the app to book your jab?
So if you contact your GP, there are slight differences around the country, but at the moment, we're the first country to get to this point. We've got 80% of the whole country double jabbed, and we've got nearly 90% of the whole country first jabbed, and we're now rolling it out fast. Now, some GP practices are rolling slightly quicker than others, and that's what you'd expect. But if people contact their GP now and go on the app, they can book to get their booster jab or their second jab.
Minister, that's not true. Minister, you can't get your booster at the moment if you're in your 20s. The question is, we were told earlier on in the week that there's a plan. I'm just asking you where the plan is and when people in their 20s and 30s can book their booster.
Well, the NHS are leading on that rollout. I haven't got at my fingertips today exactly which GP practices are making it available today, but we are accelerating that rollout, and it is key, and we are putting that in place so that the next generation, the next age cohort, can get their booster jab as quickly as possible. But the NHS has got to put that alongside clearing the backlog of cancer cases and all of the other issues that the pandemic has caused. I think the public understand that. We have to do everything we can. The NHS is flat out. I was in constituency surgeries in my patch last week, and the booster rollout and the jab programme is working. I'm not getting a lot of complaints from people saying the UK is behind on its vaccination programme. Of course, we all need to move fast, and we are, and the NHS is doing that. That's why we've put more money in to support
Minister, we only have a limited amount of time. The answer is you don't know the answer. Let me put this to you. South Africa averaging 300 cases. No, you don't.
The answer is the NHS is doing a brilliant job.
Minister, if you're in your 20s, you don't know when you can have the jab. Just admit to that, because that is fundamentally the case, isn't it?
No. The case is that the NHS is rolling out the vaccine programme, and if you contact your GP and book it, you will get your jab.
It's not true. It's just not true. It's just not true, Minister. South Africa, averaging 300 cases a day. That has leapt to 8,500 cases yesterday. How concerned are we?
Yeah, well, as the Prime Minister and the Health Secretary, Chancellor Secretary have set out, we are concerned. That's why we've put in place some pretty important, reasonable measures to make sure that red list countries have to test before they come. We're trying to make sure that the global economy can carry on working while minimising the risk. And I think that's the key. In those countries where the new variant is surging, we need to be quite tough and make sure that people aren't bringing it in, contain it, and then when it's here, make sure that we're containing it here in the UK. We did it before. We've learned a huge amount in the last year, and we'll do it again. And today, we've got all the global leaders in the vaccine industry here because the UK is leading the charge globally. This is a pandemic. It isn't over yet, and the UK is leading in making sure that we both tackle the virus and make sure that we're leading in the rollout programme.
Given that, how many doses have we delivered to COVAX? We promised 100 million, didn't we?
Yeah, the problem with COVAX actually has been, and I set up a commission last year before coming back into government, that the global manufacturing supply chains, for example, India, a major manufacturer of vaccines around the world, India was hit really hard by the pandemic. And one of the things we set out in our G7 summit in the summer, which is partly what we're picking up today, is to make sure that we've got those global supply chains. So Britain has put the funding in, we've procured the vaccines. The key is getting the rollout internationally into some of those hard-to-reach countries in Africa, in some of the Pacific Island states. And that is a global challenge. That's why we're one of the biggest contributors to COVAX, who are doing a brilliant job. We've put the vaccines in. We've got to make sure that we support them in rolling them out internationally, because, as I say, we're not safe, the global economy isn't safe until we've defeated this pandemic across the whole world.
We promised 100 million. How many have we delivered?
We've supported that 100 million. They're in the pipipeline. That isn't the issue, Kay. The issue is getting them out around the country, which is why we're focusing today on... No,
how many have we delivered?
I'm sorry?
How many have we delivered of the 100 million that we promised?
You mean have we delivered to COVAX?
Yes.
Yeah, we're on schedule. I haven't got that number at my fingertips now, but we are on schedule. The issue isn't lack of you. Yeah, but that isn't what's holding up the global rollout programme, Kate. What's holding it up, as I say, is that international supply chain issue around the world. And nobody is saying we're not globally vaccinated enough because the UK hasn't supported. Sorry?
Why are we taking so many more vaccines here in the UK then? Tens of millions more of what we've ordered. Shouldn't we, given that we're not safe until everyone's safe, shouldn't we be diverting those to third world countries?
So it's a balance, Kay. I mean, we've got another variant. I think the British public would expect us to make sure that we've made sure, to your earlier point in this interview, that we're providing the supply here in the UK. And that's why we've just procured another 114 million doses precisely to make sure we can deliver that rollout here in the UK as well. This is a balance. We've got to make sure that our citizens are safe and that the global vaccine rollout through COVAX is supported. And that is what we're committed to doing. And it's why today we've got, as part of that G7 follow-up, all the global leaders in vaccine science here in the UK at number 10
told me 3 times
to
now,
make
Minister,
sure we're
that they're all
continuing
here.
to focus on it.
OK, great, we've got that point.
Okay, because it's an international challenge.
I can go on, because we only have a short period of time. As you know, Minister, it's always difficult when you're not with me, because obviously I'm interrupting you, so forgive me for that. Given that you say that we need more vaccines in the UK, are we going to inoculate 5 to 11-year-olds? They are in Italy and they are in Israel.
Well, we're looking at the science on that and the balance of rollout. Patrick Vallance, as our chief scientist, and Chris Whitty are advising on that, and it's their advice that guides us. The urgent priority now, as you highlighted earlier, is to make sure that we roll out the jab programme through the population. And with Christmas coming, we want to make sure that as many people as possible are double jabbed. I think in due course, we would like to make sure that all of those who are vulnerable have the right level of protection. The data at the moment suggests that young children are much, much less vulnerable. But as and when that data changes, we're guided by the science and we stand ready. It's partly why we've procured the vaccines, to make sure that we can deliver what our citizens and patients need.
OK, we are out of time. I just want to ask you one final question before I let you go, though, Minister, if you will indulge me. Apparently, Emmanuel Macron has said it's very sad to see a great country with which we could do so much led by a clown. Talking about Boris Johnson, what would you say in response?
Well, I think we're into pantomime season, aren't we? And there's a French election coming. It's a pretty unhelpful word. Of course, the Prime Minister isn't a clown. He's the elected Prime Minister of this country with a very big mandate, leading this country through the pandemic. The truth is, we are looking to work very closely with France on the border issue, on tackling the problem of European migration at source. That's why we're investing in trying to stabilise countries so that people aren't coming here. And with France, we need to make sure that people in France aren't being supplied with boats and being pushed out into the Channel. The Home Secretary is working closely with French counterparts on it, and the Prime Minister and the UK government is looking for a sensible conversation with France about it. So I'm confident that actually Anglo-French relations are rather better than that quote suggests.
Are you planning a lovely Christmas? Well,
I think all of us are hoping that this Christmas we'll be able to enjoy more freedom than we did last Christmas. But we're in this pandemic, and hopefully this new variant isn't going to sweep through the country, and we won't have to put in place those restrictions last year. And the vaccine programme is our best defence against that. So I think everyone, as the Prime Minister said, should be able to plan for Christmas, but we're going to have to be sensible, and that's why we've upped the guidance. Masks on public transport, masks in shops, but we also want people to be able to go to clubs and to pubs and be able to have a drink and eat, which you can't do if you're wearing a mask. It's common sense, really. I think the British public understand that. The more we can prevent the transmission of the virus, the more we'll be able to enjoy the freedoms we all cherish. And to me, wearing a mask on a tube in winter weather particularly isn't onerous. And I think if we wear masks in shops and on public transport, we've got a higher chance of being able to enjoy those freedoms we all cherish.
OK, good to talk to you, Minister. Thank you so much for taking the time. Much appreciated.
Thank you, Kay.